I'm Dr. Brose, and I'm the founder of the Health Education for Living with Pain program. Today I wanted to talk to you about activity monitoring. Activity monitoring is a term that we use here in the health program to describe a whole series of important measurement events that help us as your doctors work with you to minimize the impact of your pain. Activities are simply the things that we need to and want to do each day. As medical providers, we tend to think of activities in terms of recreational activities, social activities, or vocational activities. While there may be other activities that you want to consider and care about, by looking at these three particular areas, we can get a relatively good picture of how your pain is impacting your life and how the treatment strategies that we're using are impacting your life. Our goal is to have the optimum utilization of our healthcare resources, whether they're medical, prescription, rehabilitative, or psychological, come to bear on these activities. Many years ago, I learned that the definition of pain that Aristotle provided was the absence of pleasure. Thinking about that definition, what I'd like you to recognize is that this focus on activity helps us establish the important activities that give you pleasure, that give you joy, that give you some sense of meaning and purpose in your life. By focusing on activities that are pleasurable, by focusing on things that give you enjoyment, we know that your day will be filled with more and more meaning. Recognizing that we're not able to cure your chronic pain, but that we can make your quality of life better by helping you engage in activities that are important, we developed activity monitoring. As you work with my staff, they will be educating you about the goal setting, the role assessments, and the establishment of particular goals for your activity monitoring forms. Through direct and remote care that we provide, we will be talking with you more and more about what are the particular goals you want to do on an individual day or on a particular week. We will be reminding you of those goals, in part to hold you accountable to yourself for your own ideas, for your own desires, and in part to give you the sense of support that you need to be successful in achieving those goals. As we review the activities with you, we'll encourage you to set realistic goals, goals that can be attainable so that we can help you build on success after success, rather than setting goals that are too high and then having you experience the sense of failure associated with not being able to pursue those goals. Activity monitoring is a cornerstone of the functional restoration approach. Without activity monitoring, we don't have the tangible evidence of the benefits of our treatment, and we can't help you learn and understand the benefits of each of the components of the therapies that we're recommending for you. Patients who integrate activity monitoring into their life often tell me that they recognize it to be the single most powerful and important tool in the entire treatment that we give them. More powerful than their medicines, more powerful than any of the individual exercises, whether psychological or rehabilitative in nature. Activity monitoring combined with appropriate pacing, goal setting, really are the primary foundations for your chronic pain treatment. By learning about activity monitoring, by helping you establish appropriate goals in the social, recreational, and vocational area, we can help you transition through the stages that are created by chronic pain. The stages of disconnection with your family, disconnection with your friends, disruption of your work. With these tools in place, we can help you identify clearly and concisely the best doses of medicines, the optimal amount of exercise, and the other kinds of healthcare resources that are going to be necessary to help you best manage your chronic pain.